Good afternoon. My name is Tim McBride, and I'm the chair of the Health Policy Specialization. And I want to speak to you this afternoon about the Health Policy Specialization at the Brown School and what some of the reasons why you might want to choose this, and some of the career opportunities, and some aspects of our curriculum. Um, our curriculum is focused on health policy analysis, and let me talk some about why you might be uh, interested and why you might want to study health policy. I'm sure you all know about how big a topic health policy is in society these days, especially since the passage of the Affordable Care Act in um, in 2010. And we have many faculty, staff, students, researchers focusing in on the Affordable Care Act nationally and at state level. And we talk about how policy influences um, public health, and is one of the factors that influences public health, and how public health influences policy in the reverse. And in the recent pandemic, there are many policy elements that have played out, and that's obviously um, been a major focus of the last year or more, and probably will remain so for the next several months, if not longer. Um, Students who dive into the topic of health policy at the Brown School um, have a series of courses that will help them, not just our first foundational course, but some more specialized courses, including some methods courses, as well as a policy and politics course, cost benefits course, and other courses. But we also have some pretty unique transdisciplinary courses, including one that we're pretty proud of, that allows students to go to Washington, D.C. for a week if they wish, um, and experience policy in, where most of it's made in the United States, at the federal level at least. Um, should mention that we have a new social policy program that opened in 2018. One of the things that's unique about the Brown School is we have social work, public health, and now social policy all under one roof. You won't find too many schools that have that. We have many faculty working in research and um, other aspects of policy in Washington, D.C., at our state capitol in Jefferson City, and in local government in the city and the county, especially during this pandemic, and internationally. So that students will have that opportunity as well. I'm one of the co-directors of our Center for Health Economics and Policy, which also gives students an opportunity to dive in through that center, which is mostly a research-oriented center, but also takes research to policy and disseminate it to policymakers. We have another center that does much the same, but for a broader set of topics, called the Clark Fox Policy Institute, which talks not just about health policy, but also family policy, welfare policy, transportation policy, poverty policy, and more. So, so, so these are just some of the reasons that health policy could be a fascinating and exciting topic to do at the Brown School. Um, so, what would you be preparing to do if you got a degree in health policy through the MPH program? You would study, how health policy is made, what are the programs, laws, and public policy, and how it impacts public health. What are some of the theories and evidence about that? Um, and as I mentioned, we have some analytic courses that allow students to learn the state-of-the-art health policy methods, so that our students are versed in that if they go to state government or federal policy, or into research jobs, or even into the private sector. Um, I think we also prepare students in a broad transdisciplinary lens of policy, including equity issues and health disparities. It's a big part of what our school does, and a major part of our focus in recent years. And so students will get that equity lens around policy, and we also give students a strong transdisciplinary lens. And we have connections to many of the other schools at Washington University, especially the medical school, but also the other 6 schools at the at Washington University, including the law school, the business school, arts and sciences, and other schools. So it's required through the MPH process, through the national accrediting body, that students have a practicum during their time at the Brown School. And here's a long list of some of the sites where students have done practicums over the years. And you can see it's a broad range of places. And these are also places combined on one list where our students also have job placements. So if you're interested in where our students get jobs, there's sort of combined on the same list. So it's everything from the typical sort of public health governmental jobs in federal agencies and state and local public health agencies with a policy bent to them, even in representative offices at the state or federal level, working on state or federal policy, to health systems, sometimes hire health policy people to help work on what they're doing, and nonprofits, of course, work in the policy area, and I find it very helpful to have somebody who has a deep understanding of health policy. People might not think about the fact that since it's called public health, that sometimes the private sector might hire people that have some knowledge of health policy and public health, but that's increasingly happening by insurers and payers, as I mentioned, hospital systems, health systems, and consulting groups, also hiring health policy students, especially since we train our students pretty give them a strong methods background. And then finally, I would say that some of our students go on and have research careers, even at our own institution or at other institutions, working in health policy, or go on and obtain additional academic degrees, PhD, for example. So there are that gives you a sense of where students either go to get a practicum or else where they go off and get their career opportunities. So I hope this brief overview of our health policy specialization helps introduce you, and we would be very excited to have you join us at the Brown School. And please reach out if you have any questions to myself or anybody at the Brown School. Thank you very much, and have a good day.